today's closing session, Real Talk, Real Stories, Real FP. For the next 90 minutes, our community members from different countries will share firsthand personal stories on why family planning access and care is essential to them and how it's been affected by the pandemic. This is just the start of a global conversation. Today, we are officially launching the ICFP Voices Community Action. We invite you, our partners, to submit first-hand experiences that highlight the importance of making family planning services and products universally available and accessible. With this campaign, we will be showcasing the many different and diverse perspectives that make up the ICFP community. Check out the details on how to participate under the Community tab on the ICFP website. One last thing before we hear from our community members. This plenary is also simulcast on Facebook. You can head over to ICFP's Facebook page, which is linked from the session page, to virtually meet and interact with some of the speakers while listening to their stories. And now it's time to hear from our community members.
When I was 25, I had a pregnancy scare. I recall feeling so afraid that I stayed at home for an entire week, unable to go out to get a pregnancy test to confirm my fears. I felt sick, but I was sick with fear that I had disappointed my mother, fear that I was about to become a mother at a time that I certainly wasn't ready for it. And this fear was fueled by some childhood memories I had, specifically a memory of what happened to my cousin when I was just 5 years old. My cousin had gotten pregnant in her last year of secondary school. As a result, she had to quit school. She could no longer go on to the university. She could no longer chart her life in the direction that she had envisioned it would go. Her dreams had to change. I remember this entire period in my family being a very painful and emotional period for everyone, especially my mother. And I recall her saying to me, "Ma dojuti mi, shogbo, don't disgrace me, don't disappoint me, you hear?" But here I was, 25, unmarried, possibly pregnant, almost certainly about to disgrace my family. And I was also going to become an unworthy role model for my younger sisters. This was a responsibility, a task that my mother had drummed into me over the years. I had 2 younger sisters. Be a good role model for them. So of course I was scared. I was scared that my life was about to take a different turn. Fortunately, I saw my period. Oh, I remember how relieved I felt. I remember feeling so happy. But then I started to ask myself, is this how it's always going to be? And I said to myself, no, this has to change. You have to do something about it. Why not get a contraceptive? Oh, but then as I began to read about contraceptives, I started to remember some of the other things I had heard growing up. Growing up, they would say, girls who use contraceptives will never have children. They'll be infertile. Girls who use contraceptives will die. Now you see, I did not want to die. And I certainly wanted to have children in the future. But then, to use or not to use? So I asked myself, which one are you more afraid of? Which one bothers you the most? And I realized, I'm going to do this. I'm going to get a contraceptive. So that particular month, I got my first contraceptive. It was a daily contraceptive pill. I used it, and when my period came at the end of that pack, I remember how relieved and how happy and how excited I felt. But I also asked myself, was this it? Nobody died? Was it really so simple to prevent pregnancy? And yet I had spent all my adult life agonizing over my period every single month. I remember how confident I felt when I suddenly realized that I had a say in whether or not I was going to get pregnant that month. I could actually do something. I could actually, I shall say, take a stand. And from that time on, as I progressed in my contraceptive journey, I have become a voice. I've become a means for other women to be able to discover what it means to prevent pregnancy through my work, through my career. Today, I'm a pharmacist, an entrepreneur, and a mother of one energetic child. And I'm a mother by choice and not by accident. I look forward to one day teaching my daughter that pregnancy is not the devil to be feared. Pregnancy is not a punishment. Pregnancy is simply a choice to be made when you are ready.
6 months after I had my second child, I decided to pick up a family planning method known as the IUD. As a resident living in one of boundary communities called Areko in Ogun State, basic amenities such as healthcare services is a major challenge, and it is difficult to access sexual and reproductive health rights services. So I decided to travel to a neighboring state called Lagos State to pick up the IUD. To beat the traffic and the long queues at the health center, I decided to leave home as early as 6 a.m. 2 hours later, I got to the health center. Surprisingly, I was the only one at the health center. I was relieved because I knew with that, I would get back to the house in no time to meet my baby. After the registration, the attendant asked that I wait for the matron. Along the line, I realized that I had spent 2 hours. So I requested that the attendant confirm if the matron was going to show up for the day. Few minutes later, a woman in her mid-50s walked in and apologized for the delay. She asked why I was at the clinic. Then I told her I was at the clinic to pick up the IUD. She asked further, why do you want the IUD? Then I replied, I've been on the IUD for the past 5 years and I would like to stick to that because of my immune system. She said, I'm sorry, we do not have the IUD. We do not have it at the moment, but you need to check back. I was hungry. She could have told me over the phone while I waited for 2 hours or asked why I was at the clinic, let alone sitting down that long. She tried to collect my number, persuaded that I check back. I knew I was not going to come back. Despite the hot weather and traffic, I left for the second health center. On getting to the second health center, I asked the attendant, please, can I see the matron? I need to pick up an IUD. And she showed me a woman sitting on the bed. You see that woman lying there? She is the matron. Unfortunately, she's sick. You need to check back because she's the only one that can help. I asked further, please, can I have someone else to attend to me? I really need to pick up the method today. She insisted that I need to check back. I was angry at that moment. I was furious. I asked myself, why would health centers in an urban area like Lagos State lack family planning method? I knew I was determined to get the method that day because I can't believe I would add to the rising statistics of unplanned pregnancies in the world, about 70 million unplanned pregnancies in the world. I remembered my 6-month-old baby. My breast pad was soaked. I had to leave for the third health center that day. On getting to the third health center, the matron asked, "Madam, why do you look so tired and angry?" I replied, "Would you believe I have been to about 3 health centers today just to pick up a family planning method? I left home as early as 6 a.m. I'm hopeless. I don't think I can pick up the method today." She said, "Calm down. I think I can be of help." She checked my vitals, did some necessary tests. I got the family planning method after about 8 hours. Later that evening, I was at home. While breastfeeding my baby, I thought about several women out there, several families out there having problems getting a family planning method. I was happy I got it. It shouldn't be this hard. At that point, I knew the narrative has to change.
Hi, my name is Kota Banda. I work for the National Health Research Authority, a statutory body under the Ministry of Health in Zambia, and I work as a senior research capacity building and knowledge translation officer. So I do a lot of work with research and capacity building, and also utilization of research and health information. I am also a new mom, and it is my journey to motherhood and the experience that I have had so far, which has given me the most appreciation for family planning. For one, I deal with a lot of research, and so I was already exposed to family planning. I knew about it, but not enough, and not with the appreciation that I have had. Going through my pregnancy to motherhood was challenging for me because there's a lot of things I was not prepared for psychologically, physically, emotionally, and those are some of the things that I have been learning now. And those are things that I think that women should be able to learn, young women should be able to know as they are growing. There are so many barriers to family planning, and I think some of which contributed to my experience. Despite the exposure that I have with my work, a lot of barriers related to religion, related to my culture that prevented me from having full knowledge in family planning. And I think they contributed to some of the experiences that I had. So in my community and in most parts of my country, there's still a lot of issues with even just discussing family planning, later on access to family planning. And I will start by speaking about some of the culture issues. You can hardly speak about sex. That is a taboo in most of the homes, in most of the cultures. And so as a young woman, when you're growing up, those are some of the discussions that you do not have. So later on, speaking about options that you would have with family planning in terms of what options you have, where you can access them, those are still a big challenge, coupled with even our health system, where we do have issues of attitude to women accessing certain family planning, especially women who are not married. That is still a big problem in most part of my community. And I think that as much as our cultures can prevent or can present with barriers, those could also be opportunities for us to do something about it. Coming to religion, I have grown up in an environment that is highly religious, and that has also had a big influence on family planning. I can speak personally, and I think women, a lot of women like me, would have similar experiences. But again, I think that religion is also an opportunity for us to use to be able to reach out. So speaking about our culture and having it being a barrier to family planning, I think that there is room for us to use the structures that we have in our culture, starting with sensitization, starting with provision of information. Most cultures, most African cultures especially, they do have certain groups like the women groups. If a woman is about to get married, there are some classes or trainings or mentorship or counseling that we do have. And I think that those provide an opportunity for women to be talked to about a lot of things concerning their health. That includes family planning. I, for one, feel that from the experience that I had, that would have been a good opportunity for someone to speak to me about the options that I have, for someone to speak to me about preparing myself as a woman, but also as a young person who has big dreams and big career goals and wants to do a lot with their life. And I think family planning discussion would have come in handy for me in such a setting. Also, in our religious settings, we do have a lot of women groups, and those are opportunities that I think could be utilized a bit better or a bit more, and have open discussions that affect women's health and their well-being, women and children. And that is where I think family planning could be discussed a bit more. So coupled with, in addition to the cultural and the religious issues that we have, that I personally feel had an influence to the challenges that I had. Right now, as we are going through the COVID-19 pandemic, I think that it has had a really big influence or a big impact on family planning. So firstly, speaking as a demographer, with most of the country or most of the countries embarking on a number of non-pharmaceutical interventions, such as staying at home orders, encouraging people to work from home. Those create opportunities for a lot of unplanned pregnancies, and that is creating a lot more demand for family planning. However, as much as a lot of demand is being created by the current situation that we are going through, I think that the access to the service itself is actually less now when the need is there than previously, because of so many reasons. Different personal reasons, yes, cultural reasons, yes, religious reasons, yes, but also people are scared. People are scared to go to the health facilities where they can access different services. Many women, and from my work, I have read through a lot of reports that talk about family planning. I have engaged with a lot of stakeholders, and in my community, most women use, those who are on family planning, those who are fortunate to have access to family planning, use injectables. And we know that those would require a woman to continue going for injectables after some time. And the current environment we are in, some people actually don't even think that those services are still being provided at the health facilities. And even though some may know that, people are scared to go out. People are scared because every day you are seeing someone dying, you're hearing of someone dying, and people just want to stay at home. So I think that the impact of COVID-19 on family planning and is quite great, and it will have a really big effect on fertility issues. And to me, family planning is not just about me as a woman. It's about the life for me and my whole family. That is for my child or my children. And I think that it's tied to the quality of life that I want to give my family. And so for a woman like me, it really brings a lot of issues, because I, like I said in the beginning, trying to work on advancing my career, but if I'm in a position where I'm not able to access family planning, it puts me at a risk to have an unplanned pregnancy, and that derails some of my dreams. It derails some of the plans that I may have, but also it affects my health, because I may not be in a position physically or psychologically or emotionally to be able to carry a child. So to me, family planning is very important. To me, family planning means I'm thinking about my health, I'm thinking about my child's health, I'm thinking about my family's health, and not just health, just general health, but I am thinking about the quality of life that I want to provide for my family, that I want to provide for my children. So family planning is an opportunity for me. It's my right, and it's an opportunity for me to live the best life that I want for me and my family. Thank you for listening.
I'm called Orama Proskovia Katrina, a 19 years old girl. I come from Gulu district, located in northern part of Uganda. I am a child mother. I gave birth to my firstborn when I was 14 years old. And out of the situation I went through, because I lacked someone even to mentor me, like a mother, because I lost my mother in 2002 when I was still a young girl, because I was taken by my sister. From there, when I reached 13 years, 14 years old, she was started telling me, you know, you're big now, you can get married, you're wasting my resources. And it stopped me from going to school. It took me like a babysitter, like a housemaid. I took off from her home. She was telling me that, you know, you go and get married so that you start your own life. You're big now, you're eating my food and what. So I ran from her home, shedding tears. Then on my way, there was a man who came to me and saying, why are you crying and where are you going? I was just answering the question with tears. The man started sweet talking me, you know, don't cry, I'll keep you, I'll take care of you, I'll provide to you anything you want. So that time, I don't know anything concerning or anything about love. He engaged me into having sex with him, because that time I don't have any option. I was just stranded. Because he sweet talked me and telling me, I will take care of you. I said, now it's okay. Maybe getting this man will also turn my life like other girls like other girls. So we ended up having sex. I get pregnant. Later, the man ran away, leaving me with the pregnancy. I started struggling from there. I decided to go home to stay with my father. I decided to go back to school. I went to school. I started P7, primary 7. From there, during weekends, sometimes I even skip school because of work. I go for digging, I go for weeding, I go for harvesting. I just skip school. I don't go for school because I want something even to eat to sustain my children around. Then from there, when I went to the garden, a friend of my father came to me telling me, you know, I want to have sex with you. If not, I'm going to kill you. That age of mine, I was young, and I don't know that if anyone said something like that, you have to report. I was just there. I thought that keeping quiet will also help me. I kept quiet. I don't even tell it to anyone. So the second time, that man also met me on the way when I was coming back from the garden. He started telling me, if you don't want to give me your body right now, I'm going to kill you. I cannot even shout. The guy was just, you see, I was almost seeing my life going. He raped me. I conceived my second born. That time, I don't know even if you're pregnant, you go for antenatal. That day, I was even traumatized. I know nothing. I'm just there as a child. So the baby was also growing inside my womb. I also have the young baby also breastfeeding, and it was very hard for me. I did not even tell anyone about that pregnancy. And the man even took off because he's big, someone who have money also. Then later, when my dad died, my elder brother also, we were staying together. He married a woman. He came back with that woman, and that woman, when I go to school, I leave my children behind because she's there. So sometimes I heard that my children were also denied for food. She don't give my children food because I don't have money, I don't earn anything. Because only the man supporting. So I said, no, I also support the family because I was doing it before you were also here. And he started telling me, you go and get married. You're disturbing my marriage. And they ended up chasing me from home. I started living with my two children. That day I was having 2,000, only 2,000 Uganda shilling. And it cannot even buy a kilo of posho. I went with my children while crying, carrying our clothes. From there, I went to my friend and I asked him for some little money to borrow me. That lady told me that she doesn't have money, but let me talk to her parents so that they give me one house. I started my life. I appreciated God to that family. So I went through different circumstance, but I thank God when this program called Anyakamakwiri, I heard it from my friend that there's a program they are calling girls. Then I went there. It's a USAID program. It's dealing with girls in the community, adolescent girls and young women in the community. When I joined Anyakamakwiri, they started mentoring us, teaching us about family planning, gender-based violence, what HIV. We have been tested for HIV, we have been screened for cancer screening, like cervical cancer, we have all been screened for that thing. Then syphilis, other STIs around, we are also being tested for it. And we know all our status. They also selected me to be a peer, to teach our fellow peer, to mentor them. Anyakamakwiri has improved my communication skill actually. I know how to communicate to the community well. I know how to communicate to adolescent girls and young women, like even I can communicate well to our elders around. It has given me a detailed knowledge on family planning. As I talk now, I'm also trained how to give family planning. I can also give you injectable, depot, pills. I can also teach you how to use a condom very well to protect yourself. If you're to come to my group now, you will also appreciate the change our girls they are getting on how to space our children. Then, not only that, Anyakamakwiri has given me a knowledge on saving. With the little you have, you go and save it. We plan for the money. Anyakamakwiri has also given me a detailed knowledge on solving problems like gender-based violence. You find there's a reduction of gender-based violence in our community, and the project has changed many girls in the community. This program now has helped me a lot. I can even make my own decision. People used even to abuse me. You have children and you're there, you wait, you will die of hunger. But I said, no, I will also be someone one day. As I talk now, I can even say I am a role model in our community.
Good morning. I would like to introduce myself. I am Amico Filiberta and I work here in the Philippines, and I am a journalist and I am specified in reproductive health. Our chain is here to help you. We produce different stories. That is, we work in the different regions. We are here. We are here in the in the different channels. And personally, as a woman, family planning is essential to ensure that we have this vulnerability that can help us, but we need to take care of it, and we need to careful with that with the family planning, and that it means also that I am in charge of my life and that I can lead it however I want it. When I sometimes we want to think that children are a blessing, but it is a gift of God. But this mentality is also a little bit poor, and that shows also how dependent the women are on their husbands. So we need to fight against the stereotype where we can help when we consider women as specialists of the household, where we are in charge of sharing the tradition, and me as a journalist. And this cannot be less pattern. So I have been working with a bureau and with an office, and several months ago I was invited to be part in this for this program of family planning. In this training workshop that I participated in, they told us to close our eyes, because with this training I was finally understanding what was going on. But this doesn't mean that society cannot be worked, and we were trying to accept this new training, and I was part of it, and I was using all of the different means that I had in order to be able to. Everybody wanted to avoid to have the virus, so we were all trying to. We didn't want to have issues, so women going to the health center actually declined. But this pandemic had really helped with the midwives and gave women an importance and tell them how hygiene is important, and that they need to take care of them. And in order to avoid contamination, we were telling them how they have to do family planning, and we can actually lead to this when we reach it. Family planning is very important and is cross-sectional for me. It actually improves our status as women And it helps us also to have a dialogue within the family and within society. This dialogue, this conversation will also improve slowly how the family can actually seize me and my responsibilities. First of all, it is also very important for the women to be a part of the community, and the availability of certain products, so to which women need to have access to in order to be able to work with language, with family planning. And also being able to go around in order to be able to talk to them directly. But I am unfortunately, but we are there to help the people, and we will also see, and with the different health and for different ways of communicating. But what we are trying to find here is that we have a distance between the different communities and the different health centers. There are several kilometers between the different health centers. And we've been doing this differently. Hello? Yes? I'm almost screaming over here. I don't know why you can't hear me. I'm sorry about that. I'll scream louder again. Can you hear me now? So we can have different ways and the different interviews that we have, and the vulgarization of family life has also not helping us in order to get access to it. The means that are available in order to have access in general we should not minimize the impact on the level of the different people that have. So what we are doing right now is we have this new program. So when health is part, the healthcare centers are part of family planning, the
Ministry of Population, the Minister of Health, with the Ministry of Justice have taken the responsibility to set the law in effect, and then the media take the responsibility to spread educative messages about family planning. Most of the faithful consider religious leaders as wise men, and then the leaders have more ease if they help them with family planning, either by advocating or by creating a place in remote villages to help solve access issues. For most of parents don't like that, don't approve of this for their children. But it shows the practice of life in society, the responsibility of citizens to build their future without any discrimination. The FP is a way to human dignity and the respect of everybody's rights.
So, we had sex last night. Basically, we're a little stupid and we use the pull-out method, and so you think there might be a chance that some sperm
got up the old woozies. Got up the old...
I mean, you know, because
Well, look, if
I can't
if
have
I'm honest,
any-
obviously, I think there's a chance. Otherwise, I wouldn't have had trouble sleeping. I wouldn't be so nervous. I just can't be 100% sure. So
I need to get a morning after pill.
is that, and that's over the counter, is it? Do you have to?
I've got to call into the doctor. I just remember morning after pills making me feel a bit sick the one time, but that's okay. Listen, if it makes me feel sick for a night, that's it's better than making me feel sick for 20 years.
Oh my God. It's like,
Why don't I go online and just check? It is available over the counter at many retail stores.
No, I agree with
I'm
this
amazed.
country being so complicated
I
with its
know.
thoughts about conception.
Well,
I always had like an embarrassment to, or like,
really? But that, I mean, it's going to happen.
I know, but I'm just telling you.
Okay.
I'm just telling you.
Right.
Right. It's going to, I guess it's going to happen or whatever. I don't know.
Would you consider getting a vasectomy? Let me take the camera.
Well,
Because we've never talked about this before.
I know. Oh, man. Just to answer very naturally. I don't know. I was kind of thinking about it,
Are you?
Yeah.
Huh.
Well, because I definitely don't want to have any more kids.
I think you can even go online and book the appointment and then you just go in.
that's crazy.
The fact that then we don't have to worry at all, like go through this essentially.
Yeah. I would love you to do it. So different for Megan,
Yeah.
who is now on her 4th appointment.
No,
is
and
waiting
has
for
to
a
carry
4th
that
appointment.
giant folder around. It's insane.
It's insane.
Ugh, it's just ridiculous. But I have been thinking about it, so. What a strange morning.
The only thing that's a little bit embarrassing, it was on the shelf, so I had to ask for it. The sooner you take it, the better it'll work. Okay, I can't open this. I'll probably have to wait till I get home. Hi, I'm Maxine Trump, no relation. I'm the director, producer, editor of To Kid or Not to Kid.
And I'm Josh Granger. I'm the co-producer, additional editor, and sometimes camera person of To Kid or Not to Kid.
And sometimes camera person of the film is really integral to how we made the film, because you have seen a scene that was very intimate, and it meant at times we were just picking up the camera and just capturing moments that were real life. And the scene you just saw, I like to talk about the film, where I sort of say, listen, learn by my mistakes. At the time, because I was trying to avoid hormonal birth control, we weren't using contraception, we were using the pull-out method, which really is not ideal at all.
It's not a method.
It's not a method,
As they
exactly.
say.
It's not a method.
Not really a method.
And it really then began this conversation with Josh and I. We're married, and we were talking about, well, if I'm not using contraception and I actually don't want children, what is that about? And thankfully, I live in New York, an area of the US where I can go to a pharmacy and buy the morning after pill. And it's not cheap, it's $50. But I felt very lucky that I could do that when all around the world you don't have as many options as we do here. But it began a conversation, a wonderful conversation between Josh and I, and you might want to carry on talking about that a little.
I mean, I think you see it in the clip that that's where we first really begin to talk about whether or not I'm going to have a vasectomy, which is kind of amazing that it is actually happening, unfolding on camera. But and I think my dismay at being filmed is legitimate there. Partly, well, because in the film there'd been a lot of filming, but I think I had, as I say in the clip, I had been thinking about it already, because I already had 2 children who were, I can't remember, 10 years old maybe at that point, and had, as you see in the film, Maxine and I had discussed other things, adoption had come up, things like that had come up, and so we'd been thinking about it. And I guess the idea of a vasectomy had kind of been circling around us as well, because we had run a Kickstarter in which a vasectomist was playing a role, and you know, it's funny, I can remember strangely just riding on my bike and thinking, hey, maybe a vasectomy is a possibility. So I had already been considering it when we had this event happen that you saw in the clip, and it had become more real in my mind, and it had become something that began to seem like a real possibility. And as I say in the clip, if it means we wouldn't have to deal with that scare, then why wouldn't I do it?
And I think what really transpires from the film as well is like, why aren't couples having these conversations more regularly? You know, why, again, learn by my mistakes. Don't wait until you get married to have these conversations, because that can be really damaging to your relationship. Thankfully, it wasn't, because Josh went and had the vasectomy, which was incredible, and it meant I didn't need to find a permanent form of sterilization, which I would have gone to do, but it's not as easy as getting a vasectomy. And men only have two options of using condoms or a vasectomy as birth control, and I think there should be more options than that. But if you watch the film further,
I agree. As a man, I agree.
But also, as you watch the film further, you see how easy the vasectomy operation is.
Yeah, and I think also it's been really eye-opening. It's sort of like talking about it with other people was really an eye-opening thing, because people were sort of taken aback a little bit. But then, I don't know, the more it gets talked about and the more you talk to people who are like, oh yeah, I had it done too. The normalizing, the fact that it needs to be normalized is kind of amazing. But the normalizing of it, I have felt it becoming more normal to talk about as we move along, and talking about it has felt good.
The whole reason to make To Kid or Not to Kid as well was because there isn't a lot of conversation about people deciding not to have children. And this is the first feature film that people can sit down and watch and actually break the ice for them, because where now there are books about this subject, there was nothing for me when I first started making the film in 2013. And we're now, you know, much further along, and we are seeing it written about more, but it's still seen a taboo subject, and that really should change, because we shouldn't be bringing unwanted children into the world, and you can make the choice to not have a child. And I honestly can say I'm much happier for coming through that process, and really love my life as it is and our life together, and it's enabled me to go on and live the life I've wanted to do as a woman that can seek more education, that can carry on in my career, and I've been incredibly satisfied and very happy about my decision. And so I really hope this encourages you to find the right decision for you too, whether it's to have small families, what kind of contraception you need, and asking those questions and making sure you find those answers, because we must make this more normal and access to contraception much more easier.
Yeah.
So thanks so much.
Yeah.
I really hope you enjoyed the clip, and we'll watch To Kid or Not to Kid when you can. It's available worldwide on our website, so check it out. Thanks so much.
Soy Agustina Bacani, tengo 19 años, vivo en Buenos Aires, Argentina. Soy estudiante de Derecho en la universidad acá, Universidad de Buenos Aires. Formo parte del área de jóvenes de FUSA, como dijiste. Y bueno, FUSA es una asociación civil especializada en la salud de adolescentes y jóvenes. En FUSA nos centramos en realizar actividades, contenidos para redes sociales, campañas, formación para promover los derechos sexuales y reproductivos. Y bueno, y en 2019 terminé el secundario, donde por las jornadas de educación sexual integral participaba dando talleres y charlas. Las charlas en las que participaba estaban dirigidas a compañeros míos del secundario, y bueno, y en el caso cuando fui a otro colegio, bueno, también, o sea, la edad era adolescentes de secundario. Y las charlas tocamos distintos temas. Hablamos sobre, bueno, infección de transmisión sexual, identidad de género, cómo poner un preservativo, métodos anticonceptivos, violencia de género. Tratamos mucho violencia de género, sobre todo porque a los cursos que eran más dirigidos eran primer y segundo año de 14, 15 años, y es cuando uno arranca a tener relaciones, a tener novio, novia, entonces como que hacíamos poco en ese tema. Lo clave fueron para mí las redes sociales. Yo por las redes sociales fue que empecé a leer, a darme cuenta de que había un mundo que desconocía totalmente. Antes de que, no sé, antes de 2018 o 2017, no sabía lo que era la ESI. No tenía ni conocimiento, en mis colegios nunca tuve. Y por las redes sociales fue que empecé a tener conocimiento, básicamente a saber que esto existía. Y bueno, una vez que ya estaba como muy metida en el tema, una profesora de mi colegio, Nerina, me recomendó un curso que estaba haciendo FUSA, también sobre salud sexual y reproductiva. Y fue como, bueno, vamos a ver qué onda. Fui al curso y me quedé fascinada, porque justamente esto, brindaban un montón de información que si bien algo habían leído por internet, que venga una persona con un cuaderno, con un libro que sea información segura, fue genial. Y nada, después de realizarlo fue que me sumé al área de jóvenes de FUSA. Y ahí participé en campañas como la de Quiero ESI, campamentos, talleres, etc. Lo que me marcó mucho fueron los campamentos que organizamos con FUSA, donde venían muchos chicos de distintas provincias en la edad de jóvenes y adolescentes, entre 15 y 24 años, en los que pasábamos 2 días y una noche, y nada, para mí fue genial porque compartíamos experiencias, me di cuenta de que no estaba sola, que había un montón de chicos y chicas a lo largo de mi país, de Argentina, militando lo mismo que militaba yo en diferentes lugares, en diferentes ámbitos. Eso para mí fue genial. ¿Cómo impacta a los jóvenes las barreras para acceder a la salud sexual? Para mí, de muchas formas. Al no poder acceder de forma segura y a información confiable es cuando se producen muchos mitos, estigmas, se vulneran nuestros derechos. Las escuelas para mí son el lugar principal donde se tendría que poder revivar esos mitos, no fomentar esos mitos, donde la información sea confiable, pero lamentablemente se terminan convirtiendo en una barrera institucional en la que por distintos motivos, pueden ser prejuicios, vergüenza, motivos religiosos, se niegan a brindar esa información, que para los jóvenes es sumamente necesaria, sumamente rica, y en Argentina, de hecho, contamos con una ley de educación sexual integral, pero nos damos cuenta que no se cumple. Y esto trae consecuencias como la falta de información, la vulneración de los derechos, violencia de género, embarazos no planificados, ITS, etcétera, etcétera, etcétera. Bueno, AMACE contribuye a eliminar las barreras y brindar información útil para los jóvenes. Yo creo principalmente dándole lo que los jóvenes necesitan. Los jóvenes y adolescentes necesitamos información, que nos digan lo que no sabemos porque justamente somos jóvenes y tenemos que aprender y nadie nace sabiendo. Y AMACE está ahí con videos, con campañas y haciendo lo que necesitamos, un lugar amigable, con información clara, verdadera, hablando sin tabúes, sin vergüenza, sin prejuicios, enseñando que tenemos derechos y que tenemos que luchar para que sean respetados. Y, por ejemplo, tienen unos videos sumamente riquísimos que hablan sobre, por ejemplo, bueno, la pubertad, que es un tema que no se habla, como, sí, no sé, tal vez te va a engrosar la voz, la menstruación, muy por encima, pero no van de lleno al tema y dicen, ok, no hay por qué tener vergüenza, te van a salir granitos, es una etapa linda, a la vez no tanto, pero está ahí hablando del tema, como también habla de muchísimos temas como, no sé, identidad de género, un montón de cosas. ¿Cómo fue mi experiencia validando estos videos que estoy diciendo? Para mí fue genial, porque me acuerdo que estábamos en FUSA, reunidos con mis compañeros, y estábamos viendo los videos y yo era como, wow, o sea, súper claros, súper precisos, o sea, sobre todo claros, porque tal vez encontramos videos, pero tal vez son para gente más grande, y Amei se centra bien en jóvenes y principalmente en adolescentes, como a la adolescencia temprana, se centra ahí, te lo dice bien claro como para que el chico o chica lo entienda perfectamente.
Otros métodos anticonceptivos son las píldoras, los parches, las inyecciones y el anillo vaginal.
¿Y dónde los consigo? ¿Y cómo escojo el más adecuado?
Puedes acercarte a la unidad de salud de tu comunidad o a la clínica MexFam más cercana.
Eso suena bien.
Para mí, mi lista de deseos para que podamos tener libertades los jóvenes, para mí es principalmente que se abran las mentes, que los adultos entiendan que si bien somos jóvenes, tenemos voz y voto, que sabemos perfectamente lo que queremos. Como te digo, en los campamentos me he dado cuenta que somos muchísimos los que tenemos muy bien en claro qué es lo que queremos y cómo lo queremos, y eso, que nos den voz, que nos den voto, que nos escuchen, y eso, que dejen de tener prejuicios y podamos vivir en un mundo con libertades para todos. Si estuviera con el ministro de Educación, ¿y qué le pediría para que pueda llegar la ESI a las escuelas? Le diría que ponga el ojo, que no se deje llenar por las palabras, porque tal vez de boca por afuera los directivos dicen, sí, sí, acá se cumple, pero no, que vaya a los alumnos y a los jóvenes le pregunte, que escuche desde a quién le corresponde, tipo, escuche a la persona que tiene que escuchar, que son los jóvenes, y le diga, vos, ¿recibís en tu colegio ESI? Que no se deje llenar la cabeza por lo que dicen los directivos, porque los directivos tranquilamente pueden mentir y decir, sí, sí, yo en el colegio tenemos 5 charlas por año, y cuando le preguntas a los alumnos, la realidad es otra, y dice, ¿qué? ¿Jornada Ceci? ¿Qué es eso? Entonces, que nos escuche, que es básicamente lo que pedimos todos, que nos escuchen a nosotros. Bueno, una de las campañas en las que participé en Amaze fueron, no hace mucho tiempo, hice un TikTok contando básicamente qué es Amaze y qué puede brindarle a los jóvenes, como diciéndole, che, chicos, acá hay una organización que la tiene muy clara y que está haciendo contenido muy interesante. Iba a decir una palabra muy de Argentina y era como, no le iban a entender. Muy interesante, muy clara, muy precisa, y que estaría bueno que lo vieran. Y fue así un TikTok con una tendencia del momento, como nada, es TikTok. Además, qué mejor lugar para hablarle a los jóvenes que TikTok, que es por excelencia la nueva red social en la que más están metidos. Y yo también.
Decime que sabes sobre métodos anticonceptivos sin decirme que sabes sobre métodos anticonceptivos. Empiezo yo. Para tener relaciones sexuales seguras, te recomiendo que uses un preservativo o un condón. Para más información, también te recomiendo que sigas las redes de Amaze en español.
Si quieren saber más sobre Amaze, sobre los videos que estuve comentando, sobre los TikToks, sobre todo su contenido, vayan a la página de que es amaze.org y comprueben lo que digo, son videos súper claros, súper precisos, con información súper enriquecedora y no se van a arrepentir.
For me today, to talk about family planning is talk about future, is talk about the future of youth. Hi everyone, I'm Ivan Ngadi. I'm from Ivory Coast and I belong to the network of young ambassadors for family planning in Ouagadougou. I'm 30. I'm the penultimate kid in a series of 6, so I'm the penultimate in 6 children, in the family of 6. To describe myself, 2 words, hope and perseverance. My story with family planning started with a major event, an unfortunate event. So I was going out with a girl at school who was 16, 17, and with whom I shared more or less everything. She shared her struggles, she shared her happy moments with me too, and she got pregnant because she didn't know her body very well, didn't know that not having a period for 5 months could mean that she was pregnant. For her, it was maybe something else. Maybe she was ill. Think that was going to stop and pass. Unfortunately, she was pregnant, and when she found out that she was pregnant, she wanted to end the pregnancy. She decided to have an abortion, and unfortunately, when um, she went away with it, because she went to see a woman who sold on at the market. She went traditional medicine, like concoctions, as she called them, and this medication, when she took it, the pregnancy ended, but a few days later, after she also died. So it's probably due. Donc on a essayé Our parents never took the time to talk about family planning with us of contraception. So we're left behind. And as the consequences, of course, is that we have to have unsafe abortions. So after these two experiences, I decided to get involved. And today I work for an international organization as an advocate on themes that really involve young people, which is the reduction of risk, or if you want, the risk of maternal mortality rate linked to unplanned pregnancies in teenagers. See, my personal story, as I told it to you, just led me straight to that position as an assistant first, and then I started. I became in charge of advocacy because it's a theme that it's a passion for me because of my history. Also because I think that today young people, I really believe that they need to give them the importance that they deserve by giving them the information, as much information as we can, as much knowledge as we can about their body, about their development. Today, I support my peers in several projects as evidence to action. So, and it's a project that reinforces the youth capacities to plead their cause with decision makers or the leaders who take decisions as far as development. And the population has a right to be heard. All the population that tend to be left behind. And so I'm very proud even of what I've accomplished. When I think, for instance, of setting up of a network of young people in a remote place, which talks about reproductive, sexual and reproductive health, and these people have the right information, are able to pass it on in that remote relocation. And if I think that if I hadn't been through what I did, it's thanks to family planning that I got here and made it able to happen. And there's so much that still needs to happen with young people, and I will not stop that fight. I will continue to fight this fight as long as God will give me breath, because it's a passion to serve others, to share information, and to get their attention. That people who think that the young don't have any IDs or are not responsible, or that are not conscious about their own future, because that's what we're talking about here. When you talk about family planning, it's when you're talking about the present and the future. And when we share our stories about family planning, we also share our histories about the future. So I thank you for listening to me.
Special greetings from Cameroon. My name is Clementina Njang Yong. I work with the Cameroon Baptist Convention Health Services as the head of department for the communications department. And talking about my community, we have people who come for comprehensive health services within the CBC Health Services. And in Queen Baptist Health Center, now Queen Baptist Hospital as we are talking, which is the one in the northwest region of Cameroon, and specifically in the city of Bamenda, we have many people who come here to receive family planning services. A good number of these women who come here have made us to understand just how useful and how helpful family planning services has been to them. It has enabled them, especially those women who are in the reproductive age, to make informed decisions about their sexual and reproductive life. It also goes a long way to help adolescent mothers to continue with their education. A lot of them have also testified to us how family planning has enabled them to be able to go back to school, and it equally reduces the maternal mortality in my region and especially in my community. So we don't get to hear about maternal mortality as was the case before. Speaking as an individual, actually, when I got married, my husband and I didn't have children until the time that he died. But then, talking about family planning is something I have a passion for. I come from a family where we are 11 of us, so I have 10 siblings. And I spoke with my mom, and my mom told me that she never heard anything about family planning. However, we want to thank God that they brought us up well. We never faced any difficulties. They educated us. But then that is not the case with all the families. In the northwest region of Cameroon, which happens to be one of the coldest regions in Cameroon, there is the general belief that many families in this region have more children because it is cold, and so many people tend to be in bed and then have sex and have children. And that is why they have many children within the families. So bringing family planning into this community is very, very important. And many people welcome family planning. However, there are still some people who do not welcome family planning because in this community, there are actually some myths and misconceptions about family planning. Some women think that when you have or when you practice family planning, it is a way to make women sterile and not to put to bed again. And also there are a lot of religious beliefs surrounding family planning. And some women also believe that sometimes when you practice family planning and you get pregnant after the family planning methods that you have been taking, the tendency is you may suffer miscarriages. So there are some of these misconceptions that we have been working as Cameroon Baptist Convention to wipe out from the people. And that is why we have a lot of programs that have to do with education, sensitizing the population about family planning so that they know exactly what family planning is all about. Practicing family planning has none of those things that they will think will happen to them. We let them know that there are so many women who have practiced family planning, and still at the end of that family planning method, they have been able to have their children and they have delivered them without a problem. And we are also using leaders, traditional rulers, especially within my community, and some leaders are the people that we know when they talk about family planning, when they talk about any other thing, any other health campaign that we have, the people will easily believe and take to what they say. We know that many women live in this community through agriculture, especially in the villages, and their economic strength, their financial strength, therefore, is not very, very strong. And so practicing family planning sometimes is very important so that from the little amount of money that they have, they should be able to take care of the number of children that they have. They will be able to send them to school. They'll be able to clothe them. They'll be able to feed them well. And there'll be no problem when these children grow up. And I also like to mention the fact that when it comes to COVID-19 and access to family planning services, it has been really difficult, not just for family planning, but for other healthcare services within our facilities, because a lot of women, they fear coming to the facilities because they think that they risk contracting COVID-19. So the number of people who turn up for healthcare services, including family planning, is dwindling. That is something that has been going on. In the northwest region of Cameroon, where we live in our community here, I can see family planning services are moving on well, but there is still a lot of sensitization that needs to be carried out, especially to when it comes to specific groups specific target groups that we have to work with when it comes to family planning. For instance, the Cameroon Baptist Convention Health Services works with sex workers. We have a lot of sex workers that we've been trying to bring them in through program to make them accept family planning and be able to use them. It has not been able to extend to all the parts of Cameroon yet, but hopefully we should be able to do this, because when we work with specific target groups, we are able to also have the people who are really in need of family planning more than others. Everybody needs family planning. Everybody needs it. But then there are some groups that are more exposed to unwanted pregnancies more than others. And so we target these groups in a specific way as well. So I would like to say that the future of family planning is bright. And we as an institution, the Cameroon Baptist Convention Health Services, is leaving no stone unturned to ensure that family planning services reach out to people in the communities. And we also try to make our church leaders to know that family planning is good, because it helps the children that are put to bed to be able to be brought up in a dignified manner. And so when talking to them, it's always good to also back it up biblically for them to understand why family planning is important for people to practice. They can practice the natural methods. Some of them can practice the artificial methods, and it all depends on the choice of the individual. We give them the information and they are able to make informed choices. Thank you very much and have a great time.
I am called Jacqueline Fonko. I'm a medical doctor and I come from Cameroon. I grew up in a community which was quite remote, a community where any discussion around youth and sexual reproductive health, youth and family planning was a taboo. Growing up in this community as a young girl who has dreams alongside my friends, I was very troubled when at one point I saw how the dreams that we had together as young girls were taken away from some of my friends. This was a very hard thing to deal with as a young person, because I felt helpless. We didn't know what to do. These are young girls who had dreams, but because they never had information about their sexual reproductive health rights, they became victims of circumstances that they didn't have a lot of power over. So when I eventually got to med school, the very first time that I heard about family planning was in a medical school. I think 4th year in the medical school, you can imagine that. Even the kind of knowledge you get about family planning, its knowledge is the clinical knowledge, what you're supposed to know, all the different methods of family planning, how they work, and how to prescribe these methods. It was not really knowledge that prepares you how the different challenges and the narratives that are within the community. When I graduated from med school, I went back to my region, which at that time was undergoing a very severe humanitarian crisis that had affected schools. And more than 90% of schools were not functional. As a result, young people were now just seated back at home. A lot of people were displaced from the suburbs to the capital city where I was working in Bamenda. And just a few weeks into my practice, I could quickly tell that there was a problem. In as much as I had friends back in the community where I come from, the small community where I come from, who had experiences about their sexual and reproductive health rights that marked me, but it was a bit rare to find at that time. 3 years ago, when I started practicing, it was now very common to be seated in an office and see this teenager who comes in and is either suffering from a grave complication from an unsafe abortion that was committed at home, or is pregnant and is seeking for abortion care, which is not legal according to the Cameroonian law, or who just came with symptoms and didn't know that she was pregnant. I remember one of the instances, I had this young girl. She came to the office, she had symptoms. And after the consultation and the laboratory tests that we did, it confirmed that she was pregnant. When I told her that she was pregnant, this little girl was so overwhelmed and she did not know how to leave the office because she was accompanied by her uncle's wife who was waiting for her just out of the office. And now she knew that moving out and telling her that she's pregnant will eventually lead to her being sent away from home. And so she told me she doesn't know how to go about this and I should help her. And these and many other experiences that I had really made me to understand that this was a big problem. And I really wanted to do a little bit more than what I was doing at that time, because currently what I was doing was just receiving these young girls who are already come at the time when there's not much that you can do. And that's the reason why I started doing community advocacy, talking with my colleagues to find out what their experiences were. And they were very similar experiences. But now I'm a young girl and I know what it means to live in such an environment where you can't talk about these things, despite the fact that they are the experiences of young people. And so we also started going out to the community to talk with parents, to talk with different stakeholders within the community to hear what their thoughts were. I remember in 2018, when I had the scholarship to attend the International Conference on Family Planning in Rwanda, it was a very unique moment for me because interacting with more than 500 youth leaders from different countries and having sessions that really built our skills on advocacy and engaging different stakeholders, it was very a wonderful experience. So when I returned from the conference, I had the courage now to co-found the organization which I lead called Youth to Youth, so that we could really be concrete in what we were doing and we could have a targeted audience. So since 2018, we've been able to do a lot through this organization. And I remember just last year with support from the UN Foundation, we conducted a project and we met with 10 stakeholder groups from the Bamenda Health District to assess the impacts of the ongoing Anglophone crisis on the sexual and reproductive health of adolescents and young people within the Bamenda Health District. And having parents, pastors, teachers, youth leaders, different religious leaders, heads of NGOs, the media, come around and discuss the experiences was really mind-opening and challenging for everyone who participated during this program. I remember when we met with the quarter leaders and they had the experiences of their colleagues, some of them took upon themselves the initiative to go back to their respective neighborhoods, conduct a house-to-house census to see what was happening. And we got a report from one of them giving statistics of the number of teenagers that they realized were pregnant, and they were really surprised with what they found. And they started an initiative to talk to parents, to engage parents, to lead the entire community to initiate a dialogue around youth and sexual and reproductive health. We had pastors who went back and organized youth programs in their churches. And so it has been a long journey. And what we are seeing is a bit of progress that we are making, having different people from different backgrounds who are beginning to have these dialogues within the community. But when COVID-19 hit, it really changed a lot of stuff because now public gatherings were restricted. Now the health system is really weakened. You can't just refer young people to go to a family planning service within the hospital structure to pick up a family planning method. And it was, it really hit us hard because now we're dealing with a double crisis. And as an organization, we're thinking, what can we do to be able to change this? Because now these young people are still being affected. They are victims of gender-based violence. They are young people. They are exploring their sexuality and they are vulnerable, but they need this information. And so one of the things that we are now embarking on is how to harness technology to inform young people in a very inclusive way what they should know and where they can access services. So we see the future of family planning now to be centered around using innovative and disruptive ways, using technology to inform young people, to have partners who, with the use of technology, can offer unbiased, affordable, and accessible family planning services and information to young people. And that's the future that we see in our community. And we are really hoping to embark on this. Thank you very much.
Wow, those stories were truly inspiring. I hope that you all had an opportunity to chat with the storytellers on our Facebook page. I believe they will be online for a bit longer. Remember, this session is just the beginning. The stories you just heard only represent a sliver of the diversity, experience, and perspectives of the ICFP community. Now that we have officially launched the ICFP Voices Community Action, we invite you to find more details under the Community tab on the ICFP homepage and help us put a spotlight on the many perspectives that make up the ICFP community. This campaign will last through the conference in Thailand, where we will be showcasing the full set of stories and perspectives. Thank you for joining us for day one of the Not Without FP Forum. We have plenty more in store tomorrow with a morning plenary focused on the data, actions, and solutions behind the drive for universal health coverage to include family planning, followed by multiple engaging community sessions that explore the family planning and reproductive health sector's response to the COVID-19 pandemic through the lens of the private sector, advocacy and accountability, the demographic dividend, youth, and humanitarian and crisis settings, and the best practices that have emerged. Tomorrow's closing session will feature an exciting look into the future of FP 2030 with Executive Director Beth Schlochter, and an incredible story of inspiration about the power of creatively engaging community around family planning and reproductive health from Mr. Condoms and Cabbages himself, Kun Michai Viravedia. And what would an ICFP be without a powerful message to carry us forward through song? Broadway stars Leah Shalonga and Jamila Sabares Clem will perform songs they have written in salute to the family planning community. We'll see you tomorrow at 8 a.m. Eastern Standard Time to kick off day 2.
Wow.